Thank you so much, Chair Clyburn. And I want to thank all of our witnesses who are here today and presenting to us. And I know how difficult this is. Dr. Walensky, you and I have had conversations, and, much of my frustration over what's happened through the pandemic, especially as it's related to the CDC or the NIH, is more the function of bureaucracies and how bureaucracies work, rather than sometimes the individuals who are personally involved, or you as director for the short time you've been director of the CDC. So I just wanted to say that up front. And also, having been a director of the Department of Public Health, I also have some concerns when I became the director of a department that the majority of our function was not related to what I think is the most important function of the CDC, which is disease control, which was our first and primary mission, which is a national security issue, versus the shift towards prevention. And I think that we know why that's occurred, but yet it lends a level of frustration because we don't have the immediacy that we need when it comes to handling a pandemic. Also, we're, Dr. Murthy, Dr. Walensky, Dr. O'Connell, as physicians, as published authors, medical doctors, we published in medical journals, and as you all know, firsthand, that there's a requirement for disclosure. That's disclosures of financial financial interest, and that's also disclosures of any conflicts of interest. So Dr. Walensky, I just wanted to ask if the CDC, when they published their February 2021 guidance, did you think to put a footnote to the teachers union or to disclose that there was a conflict of interest in getting information almost verbatim from the teachers union?
Thank you, Dr. Miller-Meeks. So, I think our guidance and recommendations are a bit different than publication in a medical journal. We do, by standard practice, get feedback from many different organizations, from many different stakeholders, not just in our school guidance, but in other guidances as well. And so we don't necessarily list who we speak with to receive that feedback. As you know, as a prior public health official before, we routinely engage with ASTO, NACHO, CSTE, our public health jurisdictional partners. In this case, we also engage with school superintendents, state boards of education, with parent organizations, superintendent organizations, National Association of School Nurses.
Dr. Walensky, I didn't see any footnotes or any guidance that was directed from the state of Iowa, which reopened its schools in the fall without any incidents, without any super spreader events. We opened schools in the August of 2020 to no detriment either to our teachers, to the staff, or to our students. And when you look at the effect upon students, and I know I have emphasized this and I will continue to emphasize this because our response to the pandemic is based upon the precedent this year. So we just reduced the number of COVID-19 pediatric deaths, the CDC, by 24% over a coding error just a couple of weeks ago. I'm equally concerned about the excess deaths through the pandemic, and we have discussed this before. The excess deaths have now surpassed 1 million deaths according to the CDC, and the number is probably larger than that because deaths attributed to COVID may in fact have been to other comorbidities which would have caused death regardless of whether someone was infected with COVID-19. These have been from increased deaths from heart disease, from stroke, from diabetes, from non-cancer diagnosis, delay in cancer treatment, and advancement of cancers because there was neither diagnosis or treatment. But even more remarkable than that, and was predicted, and I was one who authored a paper on this back in April of 2020, the deaths from increased mental health issues, whether they be depression, anxiety, and then resultant suicide, the deaths from increased drug use, addiction, and deaths from overdose. And most importantly, those deaths are occurring in the 18 to 45 year age group and younger in suicide prevention. As you know, the Nevada school system opened up its schools in 2021 because of 18 deaths in a 9-month period, the youngest of which was 9 years old. That's a travesty that we have foisted upon our children who are the future of this country. And so we know that children, and this is developing into their pathway of resiliency. How are they going to be resilient in the future when they're, their very most early learning years are in a pandemic, in masks, not in school, without the social interactions they need? So I think it's extraordinarily important that we look at, which I have not heard until recently from the CDC or NIH, that we look at the consequences, the risks and the benefits, and there are significant risks to how we perform during this pandemic and our actions. I want to ask then, as we've heard today, we know that you worked on the teachers union to establish school reopening guidance, but I'm interested to hear if you've taken the excess deaths data into consideration. How did the data show rising drug overdose and suicide deaths? How did that impact your guidance? And did you communicate with other groups such as the American Academy of Pediatrics or the American Psychological or Psychiatric Associations who have declared a national emergency on children's mental health, and the WHO a world emergency on childhood poverty, which will take decades to recover?
The gentlelady's time has expired. I'm going to allow a very short answer.
Yeah, maybe I will.
Mr. Chair.
Thank you for that. Maybe you and I have had numerous conversations, or at least a recent conversation about this. Maybe I will just say I'm happy to provide a list of the engagements that we had, of course, to articulate our school guidance. And I also really just want to commend the state of Iowa for being able to open safely, but also note that only 46% of schools were open at all. And part of that is because how in this, the early part of this pandemic, and really throughout this pandemic, an uneven distribution of where the cases are around this country. Just really an important point on data. We in this pandemic at CDC have needed to work with real-time data in this emergency and to report it outwards. From our death data, we make decisions, but in fact, those decisions, as I know you know, having run a Department of Public Health, especially with death data, we get them in real time, and then we get more sophisticated, more validated death data from other sources in later periods of time. So we are constantly updating our data, validating especially those death data. Cause of death data, as you know, also really difficult, but we're working towards that as well. Thank you.
Thank you so much, Mr. Chair, for indulging our extra time. And it's hard to send more money without reforming the CDC and its critical mission. I yield back my time.